Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, welcome to 5 to Thrive Live, a podcast about thriving for those who have been affected by cancer and chronic disease. I'm Dr. Lisa Schuler, and I co-host with my good friend and colleague, Carolyn Gazella. You can find all of our past show podcasts on every major podcast outlet, and you can also find a schedule of the shows on ithriveplan.com. Well, I'm very excited because this show I will be talking to Dr. Rosanne Sheinberg about how and why she incorporates anti-inflammatory lifestyle recommendations into her pain management practice. I'm so used to calling you Rosie, but I will try to be professional here. Dr. Rosanne Sheinberg is an associate professor of anesthesiology and pain medicine at the University of Washington. Her areas of clinical expertise include cardiac anesthesiology, perioperative transesophageal echocardiography, and integrative perioperative and pain management. And prior to receiving her undergraduate degree in biochemistry from the University of California, Davis, she was a member of the Joffrey Ballet in New York City, and she toured as a member of the Phantom of the Opera and danced for Carnival Cruise Lines. So she's a Renaissance woman, to be sure. She completed her medical training at the Johns Hopkins and then pursued a fellowship in integrative medicine through the Andrew Weil Program of Integrative Medicine at the University of Arizona. And she's also trained in medical acupuncture. And I've had the great honor and privilege of knowing Dr. Sheinberg for some time. She's a delight, and welcome to the show.
Thank you so much. I'm thrilled to be here.
Well, good. And we're going to have a very interesting conversation. But before we start that, I do want to thank our sponsors that make this conversation possible. So we have Cetria, a patented form of glutathione, which is clinically proven to raise blood glutathione levels. And glutathione is a master antioxidant, so that's one of the body's primary defenses against free radicals. And it also helps respiratory health, and you can learn more at cetriaglutathione.com. We also have Cognizin Citicoline, which is nature's way of keeping the brain firing on all cylinders. So if you want to enhance your brain function, memory, focus, and attention, look for Cognizin on the label, or you can learn more at cognizin.com. And we also thank ProThrivers Wellness Supplements, which include ProThrivers Wellness Sleep, which is a supplement that combines higher dose melatonin with other sleep-supporting natural ingredients that's specifically designed for thrivers. And you can learn more at about ProThrivers at pureformulas.com. And finally, we have Dr. Ohhira's Probiotics, a best-selling probiotic for over 30 years. 12 probiotic strains are in this shelf-stable probiotic that does not require refrigeration due to their unique 3-year fermentation process. And you can learn more at drohhiraprobiotics.com. Okay, can I call you Rosie?
Oh, absolutely.
Oh, good. Well, Rosie, it's a delight to talk with you again. And, you know, pain is a big deal. So many people suffer with pain. And I think it's probably one of the highest or most prevalent unmet needs for people with other health conditions, because it accompanies so many health conditions. And even if their condition gets treated appropriately, they can still be left with pain. And of course, pain is part of a lot of illnesses. So what is chronic pain? Why does it happen?
You know, the what is a lot easier to answer than the why. But, you know, in essence, acute pain, chronic pain, that transition happens somewhere around 3 months. And so that becomes the definition. It's kind of pain that is stuck around longer than 3 months, which means longer than we would have suspected for some kind of process to heal itself. But, you know, they just define it as it's some constant, sometimes intermittent, but it interferes with daily life, has a lot of causes. The why is a little harder, right? You know, I think we are seeing a rise in most chronic illnesses, a lot of which I think is preventable. I mean, all the way from obesity rising in children to diabetes, prediabetes, cancer, autoimmune issues. I think modern life has really just evolved to not supporting kind of resilience building at its basis. Our plates are too full. We're
Mm.
humans who are busy, stressed, not sleeping enough. We don't have time to cook and exercise, not connecting in meaningful ways. That's just modern life. And I think that when we're vulnerable, then we become more vulnerable to things like chronic pain and other diseases.
Very interesting. I've never heard it described quite like that. So, in some sense, you're suggesting that chronic pain is a consequence of or a symptom of modern life.
You know, I think modern life predisposes us to illnesses, issues that we may not have faced before, or it worsens things that we may have faced to a small degree.
Yeah. So, the opposite then would be a what we call anti-inflammatory life. So, what does that mean to you?
Yeah. To me, I think this goes back to kind of this whole origins of this sort of field of what has become now integrative medicine. I mean, we are looking at root causes and as a primary motive, we're seeking to support, build, enhance health and resilience. And I think we're finding a common sort of theme or root cause underneath a lot of our chronic illnesses in this country, underneath heart disease, cancer, autoimmune issues, chronic pain. And I think that is chronic, systemic, low grade inflammation.
Mhm.
And how we live our lives contributes significantly to that burden of inflammation. So,
What
anti inflammatory lifestyle focuses on things that are under our control, because not everything is, right, that we're exposed to in life, but it focuses on things that we can adapt and change to lower that systemic burden of inflammation. And to me, the biggies that contribute to that are food, movement, stress, and sleep. And this is where science helps us biohack ourselves to optimize these areas and understand how to make each of these broad areas as anti inflammatory as possible.
Love that. And you've connected a lot of dots there. So I want to take us into the world of pain for a moment because, somebody who is in chronic pain, their brain is functioning a little bit differently once pain settles in. So some circuits are bypassed, others are accentuated. So people interact with even information a little bit differently when it's through the filter of pain. So I imagine that makes your job of teeing up the idea of an anti-inflammatory lifestyle as a important component of their pain management somewhat challenging. So how do you introduce this to your chronic pain patients?
Yeah. I think I always start where the patients are by validating their frustration with,
Mhm.
what they've been through, the medical system, how they've been treated in it. I mean, most patients who end up in sort of a university affiliated academic specialized chronic pain clinic have felt at some point dismissed, disbelieved, demeaned by providers. And I think, our Western system does support the idea that if our treatments, medications, injections, surgeries don't resolve all of your problems, sort of we've done everything we can in our toolkit. And now it just becomes a you problem, meaning the
Mhm.
patient. So a lot of patients almost feel blamed, like they're somehow at fault by not resolving their condition with sort of, our available treatments. But many patients come to me thinking that there must be a relationship between their pain and some of the other symptoms and comorbid diseases, but they never really had this idea of root causes validated, but they had some kind of gut sense. In fact, some patients now come to me saying they think they have an inflammation problem. Oh my God, I love it. I can't tell you. But
That's
next, I explain this kind of root cause idea using the analogy of an iceberg poking out of the water. So I tell them the Western approach targets the tip of that iceberg that you can see outside of the water, but it often ignores the vast ice underneath the surface. And I tell them the integrative approach that is seeking to kind of create resilience and works from underneath the water to chip away at that large underneath portion. Because guess what? If we can take care of that, the tip of the iceberg won't be supported by anything and it just disappears on its own. So that's kind of how I introduce it to patients.
Love it. I love that metaphor. It makes a lot of sense and I think is very true. So let's chip away at the iceberg. One of the things that is under the water there is stress. I mean, for sure. Chronic stress, chronic inflammation are joined at the hip, so to speak. And so I'm wondering if you could dive into that connection a little bit and then talk maybe about some of the ways that you help your patients to manage stress.
Yeah. Oh, you are speaking my love language. I love talking about the stress response. And I can't tell you how impressed I have been in the vast clinical connection I see between people with chronically elevated stress responses, and in particular, those who have experienced adversity during childhood. I think there is a giant link, and that link is through the autonomic nervous system. When the sympathetic and parasympathetic nervous system are not balanced and the sympathetic is chronically activated, we know that the mind and body are connected. And so that creates its own cascade of inflammatory chemicals. And that inflammatory soup, plus the impact the sympathetic nervous system has on the brain's perception of pain, it's just this 1-2 punch that makes the experience of pain much worse, in my view.
I would agree.
And so for tools, what do I do? So, we're not so advanced with precision medicine yet that we can look at someone's genetics and determine which approach to augmenting parasympathetic tone will work best or be preferred by the patient. I mean, maybe one day that would be amazing. However, my goal is to give a small range of tools for patients to explore. I start with the basics, slower, deeper breathing. We know that activates the parasympathetic tone, either 4-7-8 breath, a box breathing. I also like a technique taught by James Gordon, who is a trauma psychiatrist who heads the Center for Mind-Body Medicine in Washington, D.C. He teaches a technique called shaking and dancing, and I find that great for kind of moving some of that stuck energy, of people's past things that have happened to them in a way that other things don't. Next, I like to add something objective. So here's where we get a little more scientific. Stress in the autonomic nervous system can be a bit nebulous when we're talking about it, as it's something you can't see. However, we're a society that likes data, kind of this prove it to me idea. And so for reducing stress, what we want to know with what is whatever intervention we're taking the time out of our day to do, whether that's actually making an impact or a change on our nervous system. So I want something that definitively tells me that piece of information. And for that, I like to use heart rate variability. And so, when I was taught an EKG, it was like, if it's a normal sinus rhythm, that there's like a metronome, like your heartbeat's going to beat 1 beat every second. And it's, really regular. But actually, that's not true. While 1 beat may be 1 second, the next one might be 0.96 seconds, and then 1.04 seconds, and then 0.86 seconds, and then 1.23 seconds. So there's a little variability between each heartbeat. And that variability is completely under the control of the autonomic nervous system. So we can use that when we're doing, say, a breathing exercise. We can track that by different wearable devices nowadays to see if our system is actually shifting from a sympathetic to parasympathetic dominance. That's where I start. That is definitely not, a complete toolkit for sort of stress management, but that's where I start with patients.
Yeah, it's great. I mean, I love the combination of things that just we know reset and can shift somebody's perspective very quickly. For example, breathing. And then I think that biofeedback type of technique with heart rate variability and all the wearables that people have is really helpful, because that's where it gets very individualized. What works for one person may not work as well for somebody else. So they can kind of adjust and figure out what their secret sauce is in their pain management or their stress management. Speaking of which, I have a question for you. Do
Yeah.
you think that it's possible for somebody who's been in chronic pain to get out of chronic pain without addressing stress?
You know, I think pain is complex and it takes a many faceted approach to chip away at the entire picture of contributors that create this burden of inflammation and that erode resilience. Look, if it were a simple pain, then simple interventions, even just the passage of time would have cured it. And patients wouldn't bother to wait the 6 to 8 month waiting list just to get into our university pain clinic.
Mhm, mhm,
And stress is a relative term, right? If a person has faced adversity since childhood, they grew up, for example, with an alcoholic parent, with divorce, with neglect, with abuse, they have developed Olympic strength in their sympathetic nervous system, and that will contribute to that picture, adversely contributing to their health in a number of ways over time. So, it's a little bit of it depends.
Yeah, fair. I mean, that's a reasonable answer for sure. And I think actually kind of is a hopeful message because one of the things I've noticed in people who are in chronic pain is that there's a bit of hopelessness that can sneak in, and that itself can be a cause of stress. So I think just the recognition that the path for everybody out of that place is quite different. And as you said, multifactorial, which means there's a lot of options, a lot of ways, a lot of levers that can be pulled along the way. One of which is group visits, and I'm really interested to hear why you use this model of care in your pain management clinic.
Oh yeah. I'm loving it. So the data behind group medical visits or shared medical appointments is the other name that they're called is positive on a number of fronts. Not only does it decrease sort of wait times, it increases access to a provider for an extended period of time. These, visits are 90 minutes, 2 hours with a group of patients. And so it's increasing access to care. And education can be done in this format that all patients need. They are doing group medical visits for patients with diabetes, patients with hypertension, all sorts of different things now. In addition, peer support that they can get through this interaction with each other, with the patients with each other, has been shown to benefit those in the group. So I do it for all of those reasons. But also, I'm in the operating room most of the time and in a pain clinic 1 day a week. So I can get this information to many more patients in need if I talk to them in groups. And the
Mhm.
great part to me is we're such a specialty clinic that they already have a medical team in place for all of their individualized Western management of their pain and comorbidities. So I get to focus on adding these integrative elements and this integrative information.
Mhm. And I think that it's pain is also tends to be isolating for the person who's in pain. So I think just being in a group with other people who are kind of dealing with, suffering with pain can be itself somewhat healing. Just
It's
knowing you're not
incredibly
alone.
validating. Yeah, it can be incredibly validating that they are not the only one there and knowing other people are sort of struggling and troubleshooting the same things they are.
Yeah. Okay, so one of your group visits, you have, topics that you cover in these visits, and one of them is about diet and specifically um, kind of, I guess, well, you mentioned anti-inflammatory lifestyle, but I think a big
Mhm.
component of that is diet. So can you just talk a little bit about the nutritional component of the anti-inflammatory lifestyle?
Absolutely. I think it is easy to say you need to eat healthy. However, I think in this journey, understanding the why, going back to inflammation and how foods contribute in an ongoing fashion to inflammation is key. I tell my patients kind of upfront jokingly, I'm going to take all the joy out of their life and eating.
Mhm.
It's in jest, but in truth, we do delve into foods and how they can hit the reward centers of the brain and how for patients in chronic pain, they don't get many things that make them feel good anymore. And sometimes food is the only thing that gives them pleasure. We know foods like sugar hit the reward and the addiction pathways of the brain hard. And I go into the science of that. I even talk about animal studies that compare choices of mice for sugar sweetened beverages versus cocaine and how sugar is likened to the addiction potential of, something like cocaine. And I talk about how our food industry doesn't have their best interest in mind. They may be hiring food chemists to add ingredients to food products that hit the reward centers of the brain. So we as consumers want more and more of it. I mean, that helps the bottom line of manufacturers. So
Yeah.
next, after all the science, then we get into the weeds about, okay, how do we actually make this happen? I tell people, look, this is one problem that could get easier. If you have Oprah money and you can just instruct your personal home chef to have anti-inflammatory meals and snacks available all the time, great, do that. But for the rest of us, we really need to sort of talk about strategies, hacks, grab and go options, cheap options, backup to backup options when you're really stressed and tired and overworked. So we've spent a lot of time sharing information, question and answers about how to make sort of an anti-inflammatory diet doable. And then I also dive, besides sort of this whole food, anti-inflammatory eating, then I really dive into glycemic control, because I think between those two things, talking about whole food options, glycemic control, I think that is really the powerhouse of creating sort of your internal ideal pharmacy, your chemical soup on the inside for building health and helping resolve disease.
Love that. Love how you've really, drilled it down, and you clearly have lots of strategies that you can share that will make this workable for anybody wherever they're at, which is amazing. So can you share an anecdote from your practice that just gives us a little bit of an idea of what can happen to somebody when they engage with some of these strategies?
Yeah, sure. In fact, my first sort of integrative clinic experience that I was working with was cancer patients. But guess what? Cancer patients have pain as well, whether it's related to their cancer or not related to their cancer. They have both. But I worked with metastatic breast cancer women mostly, and they're an amazing population who are seeking information like crazy and so interested in doing whatever they can to help themselves and skew things in their favor. So in my cancer population, they would hear this information about anti-inflammatory whole foods diet, and guess what? The next day, done. They were doing it. They were walking that walk. They were so motivated. And guess what? They would come back to me, and I think my chronic pain patients here hate this, because almost as an aside, they would be like, "Oh, by the way, that pain that I was talking about last time, by the way, it's gone." So it was
Yeah.
so incredibly, it's incredibly impressive at how it's almost, I tell them, it's annoyingly impressive how well even just anti-inflammatory eating works to lower pain signals, or in some cases, eliminate them at all. But I
It
did.
is amazing. I just want to pause you for a second and just stress what you're saying, because like in seemingly intractable cases of pain, like you mentioned with people who have cancer, sometimes even the pain is coming from literally tumors pressing on nerves, which in the medical world is considered very difficult pain to address. Even in those patients, I've seen a combination of strategies that their physician provides along with diet, stress management, all the things you've been talking about. It's only when those things are combined that the effect is felt. So it's really, I mean, these things sound very sort of nice, it sounds great, but it is so impactful.
It is. It is. And it's a lot of work we're asking people to do. And so that's why I'm appreciating more and more this, constant connecting with patients regularly during the group medical visits, so that they can all kind of share this, because it is. We're asking them to change a lot of habits and a lot of things on a lot of different fronts. And that's not always easy.
Right, exactly. So what do you think the barrier is in kind of getting this information into the Western mindset? I mean, this is not rocket science. There's data behind it. Why is it so difficult for patients to hear this information?
Yeah, I think the way medical providers are reimbursed by insurance and insurance
Mm,
companies, time with patients isn't valued.
hmm.
Hearing more than one patient complaint isn't valued. So we
Yeah.
try and chop up all the little symptoms they're experiencing, this little tip of the iceberg, all the symptoms, and we divide those up into all the specialties. So they may be going to a sleep clinic for their sleep disruption, a headache clinic for their headache, the neurosurgeon's office for their spine pain, rehab medicine, pain medicine, and endocrine and endocrinologist for their diabetes, maybe their primary care doctor for their Ozempic. But no one's stepping back to the bigger picture and addressing this vast ice under the water. So the real cause in the first place. So we're just not doing patients justice this way. And we're not getting to know our patients in that model, knowing their stressors, how they live their lives, to be able to make these valuable and kind of complete recommendations.
Mm-hmm. Yep, that makes sense to me. Okay, so in our last few minutes, what final thoughts would you like to leave our listeners with?
Yeah. You mentioned hope up front, and I like to give my patients hope. They don't have to give their autonomy to doctors and health providers. They
Mm-hmm.
have the power in their own hands to be proactive and make a real difference in their own outcomes. Too many patients come discouraged after seeing 10, 15 different providers about their pain and not finding answers or relief. So one of my favorite slides when I speak at conferences or to providers and patients is this pie graph with the heading, "Where does health come from?" And this comes from a study that showed about 10 to 15% of our health comes from medical intervention. Now, I will not argue that that is not an important 10 to 15%, but that leaves the other 85, 90% comes from a combination of these life daily habits. Do you smoke? Do you drink? Are you sleeping? Stress, exercise, food, and socioeconomic factors. So there is a big chunk that the patients can have autonomy over.
Yeah, absolutely. Fantastic. Love it. Well, as usual, you are fantastic as well. And this has been a great show. And I really want to thank you for taking the time to join me on 5 to Thrive Live. So, where can our listeners find more about you and your work? And if they're lucky enough to be in the state of Washington, how can they find your clinic? Any websites you'd like to share?
Yeah, I mean, sadly, I'm not the biggest one out there. I've been thinking about, creating my own website just so I can share some of this information on a bigger scale.
Please
I'm at the
do. Please
University of
do.
Washington. Yes, I'm at the University of Washington in the Center for Pain Relief, so I'm happy to see anybody there. Yeah.
Okay. Well, that sounds good. I'll look forward to your website. I'm going to hold you to it.
Very
And
good.
that wraps up this episode of 5 to Thrive Live. We thank our sponsors, Pro Thrivers Wellness Sleep Formula, Cetria Glutathione, the superior glutathione to support liver and immune health, Cognizin Citicoline to help enhance memory, focus, and attention, and Dr. Ohhira's award-winning shelf-stable probiotic. And thank you again, Rosie, for your wonderful insights. Thank you all listeners for joining us. May you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.